Thanks very much, Denise, and good afternoon. I think I would like to start with a little preamble on that, because we've heard a lot about agriculture and nutrition this week, or these days, and it looks like a week. Often the health part then became like a function of the nutritional part. And I would like to remind the audience that, of course, agriculture health linkages have a much broader scope, which we shouldn't neglect. Other than the agriculture, nutrition, and health link, there are other disease issues, communicable diseases such as malaria and schisto related to irrigation, diarrheal diseases related to wastewater use in agriculture, the zoonosis and livestock story, HIV/AIDS in seasonable labor movement, and then, of course, non-communicable diseases, toxic chemicals, poisoning, and cancers, but also less heard of issues of mechanization and injuries and accidents, and let's not forget the mental health status of farmers. In many parts of the world, there's a high level of suicide among farmer communities, and that's a very important public health issue. Now, I have a number of issues, and I hope that in my remaining time I can go through those. The first one is that we've been talking a lot about intersectoral action and breaking down the silos. But actually, these are statements that have been made the last 30 years or so, and that keep coming back. But we don't really know about the nature and opportunities of intersectoral action a lot. Yesterday, the statement was made that we have to think intersectorally but act sectorally. I think that would be a big shame, because we lose out on a lot of opportunities that way. But shouldn't we really do some solid research, sociological research, on what the nature is of governance mechanisms, how intersectoral action fits in that, and why it's so difficult to achieve it? And then we get some of the evidence and answers. Similarly, people have been saying, yes, we have to get people trained so they can operate multidisciplinarily and intersectorally. And again, that's very easily said, but how do you actually train people for that? What sort of programs do you have to set up? It's not only the people that now are the coming generation, there's also, of course, the current professionals that are working. And there are possibilities like problem-based learning approaches that can help adult learning and get these people to actually get the skills and the capacity to work more intersectorally. And of course, we shouldn't forget that with training, there's always the issue of career structures. And in fact, I would claim that silos that we're working in are structures that help us support in our career as they're perceived nowadays. And we should therefore see, if we break down those silos, what do we do about career opportunities and career pathways? Research on communication, I think, is a very important thing, because outcomes of multidisciplinary research need to be channeled to the right people. And I know from the experience we had with our interdisciplinary research at Varda on malaria and rice cultivation, that all the papers ended up in a medical journal, which was never read by the agricultural policymakers that the outcomes were intended for. So we have to look at that. We have to find out also through research how we can get information from this woman farmer that Denise was talking about her needs, and also when we work on her needs, how we then communicate back to her what the findings of our relevant research are. Do we want to use agricultural extension workers to bring out health messages, or do we want to get community health workers bring out agricultural messages? How do we go about that? Then integration of delivery of interventions at the household level is an area that needs more research. Fadi Doumani at the World Bank and Jim Listorti about 10 years ago already said that 40% of the burden of infectious diseases could be reduced in low-income countries by 3 interventions: household water treatment, giving people stoves to reduce indoor air pollution, and giving them mosquito nets. And of course, if we can better get the evidence base for that and link that also to nutrition, which would be another enhancing factor, we would be much further in our approaches. Now, the global framework that, for instance, was produced by Mr. Hodinot on the first day makes things look globally very complicated. There are so many aspects and so many linkages and so many pathways that it becomes rather daunting to think of solutions. So I think for research, real on-the-ground research approaches, we have to start thinking more in scenarios. And one example, which I already mentioned, is the whole issue of urban wastewater reuse for agriculture. It brings together all these elements that we're talking together but in a workable situation. It's about farmer communities, their livelihood, their nutritional status. It's about food safety for urban populations. And it is about using scarce resources in an optimal way, both water and the nutrients that come with wastewater. I think the two other issues that I want to raise, one is economic research. I mean, if we want to have sectors talk to each other and we haven't yet got the people that have been trained enough to do that, then maybe economics is our common language. And so if we can get the economic aspects of food production linked to the economic indicators that we've developed in the health sector to talk about burden of disease and health impacts, then we would come a long way. And of course, the whole point of investment planning and how you can mainstream certain health issues and particularly health safeguards into that is another issue, and that links up to health impact assessment as well. And that also links to the possible points of interaction between the agricultural value chain and the chain along which we deal with health risk assessment and health risk management. These are new concepts, both on one side in the agriculture sector and on the other side in the health sector. And these meeting points, these flash points in the two chains should be investigated through research to see how we can have them enhance each other optimally. And finally, in the context of climate change, which of course is the thing that sort of concerns us all, if we could apply climate change scenarios to options for adaptation of agricultural practice and infrastructure, and then screen those options also at the same time for the health and nutrition opportunities, we would really probably have a very good framework in which to operate for that. Thanks.